Hey guys, welcome back to chapter 15, and we're going to look at pregnancy, childbirth, and the puerperium. Now, I cannot say that word, so please bear with me as we go throughout this lesson. I have such a hard time with the puerperium, which is the postpartum section, so you can laugh at me if you want, but I have practiced and I have such a hard time saying that. So anyway, I would love to hear if others have a hard time saying that word. So I might just refer to it as the postpartum section, or yes. So first we're going to look at trimesters, and I would advise that you memorize these trimesters because that will come in handy as you're picking your code selection. So the first trimester is defined by less than 14 weeks, 0 days. The second trimester is defined as 14 weeks, 0 days to less than 28 weeks, 0 days. And then the third trimester in pregnancy is 28 weeks, 0 days until delivery. Again, we have codes that are based on first, second, third trimester. And if you know what the trimester is and how many weeks the patient is, it's much easier if you have these memorized to pick the code quickly. So I know throughout the course, we have gotten lots of questions about main terms. So in looking up codes for pregnancy, childbirth, and the puerperium, we are going to have some common main terms that we're going to use to look up these codes. And the first one is pregnancy. So obviously the patient is pregnant. All of the codes in chapter 15 are surrounded by a patient who is pregnant. Then if the patient delivers during an encounter or admission, then we can also use this main term as delivery. And then we have the term outcome. And then we have, again, this word puerperium, which equals postpartum. I would just make myself a note about the main terms somewhere in your book. So when you start to look up codes, this is where you're going to go. You're going to go to pregnancy, delivery if they delivered, and pregnancy. I mean, it could be a combination of both of these. Outcome for outcome of delivery, that's something I wouldn't automatically think of. And then again, for postpartum, the puerperal. Again, if you have trouble saying it, please let me know. So let's look at some guidelines first, and then later we are going to get into some specific examples. So first off, obstetric cases require codes from chapter 15, codes in the range of O00 to O9A. Now, don't get these confused because this is actually an O. And so when you're entering your codes, make sure that you realize that this is an O and not a 0, okay? Because that can be confusing too. And on the CIC exam, you're going to have to plug in a computer, so it's going to recognize between an O and a 0. So you don't want to get these confused. So think of obstetrics and then think of O. So we have O00, O9A, pregnancy, childbirth, and the puerperium. So then we have chapter 15 codes have sequencing priority over codes from the other chapters. These chapter 15 codes have sequencing priority over other codes in other chapters. Additional codes from other chapters may be used in conjunction with chapter 15 codes to further specify conditions, and we'll actually see an example of that. Should the provider document that pregnancy is incidental to the encounter, then the code Z33.1 pregnant state incidental should be used in place of any chapter 15 codes. So this is the exception where we may very rarely see a provider document that the pregnant state is incidental to the reason the patient is presenting, because in pregnancy, most every condition the patient has is considered to be somehow impacted by the pregnancy and vice versa. But there are times where the provider may say that the pregnant state is incidental to the current condition. And in that case, we could code Z33.1 pregnant state incidental, and then we might not have a chapter 15 code as our first listed or principal diagnosis in that situation. It is the provider's responsibility to state that the condition being treated is not affecting the pregnancy. So again, in this chapter, and when a patient is pregnant, we automatically assume that everything is impacting the pregnancy unless the provider states that it's not. So let's look at an example. Pregnant patient at 20 weeks gestation admitted for acute cystitis with hematuria. So our first code is going to be an O code, and that's infections of bladder in pregnancy, second trimester, because we're in our second trimester at 20 weeks. Then we have acute cystitis with hematuria, and this is going back to our guideline where we're talking about being able to use codes from other chapters to further specify the condition if it's not already specified in our OB or our Chapter 15 code. And in this case, we have other information in this end code that provides the specificity we need to fully capture the diagnosis. So this is just telling us this is an infection of the bladder in pregnancy, second trimester, but this is telling us more specifically what that infection is. It's an acute cystitis with hematuria. And then for every pregnancy case, we are going to code a weeks of gestation of the pregnancy. And in our case, it's 20 weeks. So that's going to be Z3A.20 or 0 rather. So I want you to write down in a note somewhere that every pregnancy case, when they document the weeks of gestation, we are going to code it. Okay, so that is going to be one that you definitely can get. It's super easy to code. It's always going to be the Z3A point and then however many weeks they are. So as you see and we go through our examples, you're going to know when we see how many weeks gestation that we're going to code that with a Z3A point, however many weeks they are. Super easy. Memorize that and you'll always get it right. And again, so here we're looking at this. The documentation does not indicate that pregnancy is incidental or in any way unaffected by the acute cystitis. Therefore, an obstetrics code should be used and sequenced first. And then the additional code is needed to identify the specific bladder condition, as this is information that is not specifically identified in the obstetrics code. So final character for trimester. The majority of codes in Chapter 15, as we said, have a final character indicating the trimester of pregnancy. I've already encouraged you to remember what those trimesters are, how many weeks. The timeframes for the trimesters are indicated at the beginning of the chapter in most books. If trimester is not a component of a code, it's because the condition always occurs in a specific trimester or the concept of trimester of pregnancy is not applicable. So what happens when we have an extended inpatient admission that encompasses more than one trimester? So we have a guideline for that, and it's Chapter 15A4, and that is in instances when a patient is admitted to the hospital for complications of pregnancy and remains in the hospital for an extended period of time, it is possible for complications to develop during different trimesters. The antepartum complication code should be assigned on the basis of the trimester when the complication developed. Let's take an example here. So at 27 weeks and 6 days, we have hemorrhaging from partial placenta previa for which she was admitted. And then 3 days after admission, at 28 weeks, 2 days gestation, she developed gestational hypertension. So our first listed code is going to be partial placenta previa with hemorrhage, second trimester, because this happened at 27 weeks, 6 days. So we are going to be in our second trimester at that point. But then 3 days after admission, we have gestational pregnancy-induced hypertension without significant proteinuria that's not documented. And that's in the third trimester. And then, of course, we have our 27 weeks gestation of pregnancy. So again, here's a reminder. A code from category Z3A, weeks of gestation, are for use on the maternal record to indicate the specific week of gestation of the pregnancy. They are to be appended as additional diagnosis to the codes from Chapter 15, so they're never primary or principal. In ICD-10-CM, completed weeks of gestation refers to full weeks. And then we have outcome of delivery. A code from category Z37, outcome of delivery, should be included on every maternal record when a delivery has occurred. So what I want you to write down in your notes, in your book, in front of Chapter 15, if there's some notes there or at the beginning of the guidelines that you know when you get a pregnant patient who has delivered, you know right off the bat what 2 codes are going to be. You're going to have your weeks of gestation from category Z3A, and then you're going to have your outcome of delivery from Z37. And that represents the outcome of the delivery of the baby, single liveborn, as we saw for Z37.0. And we'll see this more as we go through our examples, but I don't want you to forget this because it's going to be 2 codes that you can easily pick up when you're looking at a delivered patient. Our next guideline is going to be pre-existing conditions versus conditions due to the pregnancy. When assigning codes from Chapter 15, it is important to assess if a condition was pre-existing prior to a pregnancy or developed during or due to the pregnancy in order to assign the code correctly. A pre-existing hypertension in pregnancy. Category 010, pre-existing hypertension complicating pregnancy, childbirth, and the puerperium, includes codes for hypertensive heart and hypertensive chronic kidney disease. Pregnant women who are diabetic should be assigned a code from 024.0 to 024.3, diabetes mellitus in pregnancy, childbirth, and the puerperium first, followed by the appropriate diabetes codes from E08 to E13 from Chapter 4. For gestational or pregnancy-induced diabetes, codes for gestational diabetes are in subcategory 024.4, gestational diabetes mellitus. No other code from category 024, diabetes in pregnancy, childbirth, and the puerperium should be used with a code from 024.4. Codes Z79.4, long-term current use of insulin, Z79.84, long-term use of oral hypoglycemic drugs, and Z79.85, long-term current use of injectable non-insulin anti-diabetic drugs, should not be assigned with codes from subcategory 024.4, gestational diabetes, and that is because they actually, the last or one of the characters represents if the patient is diet controlled on insulin or is using oral hypoglycemic drugs. And we're going to see an example of that in our cases. So for alcohol use during pregnancy, so codes under subcategory 099.31, alcohol use complicating pregnancy, should be assigned for any pregnancy cases when a mother uses alcohol during the pregnancy or postpartum. Same for tobacco use. So codes under subcategory 099.33, smoking or tobacco complicating pregnancy, should be used or assigned for any pregnancy case when a mother uses any type of tobacco product during the pregnancy or postpartum. And then the same goes for drug use. So codes under subcategory 099.32, drug use complicating pregnancy, should be assigned for any pregnancy cases when a mother uses any type of tobacco product during the pregnancy or postpartum. Use a secondary code from category F11 to F16 and F18, F19 to identify any manifestations of drug use. So peripartum and postpartum periods. The postpartum period begins immediately after delivery and continues for 6 weeks following the delivery. The peripartum period is defined as the last month of pregnancy to 5 months postpartum. A postpartum complication is any complication occurring within the 6-week period. So now we're going to look at encounter for a full-term, uncomplicated delivery. So there is a code, and it's 080. And code 080 should be assigned when a woman is admitted for a full-term, remember that, full-term, normal delivery, and delivers a single, just one, not twins, not triplets, a single healthy infant without any complications in the antepartum period, during the delivery, or postnatal during the delivery episode. This is further defined as a delivery requiring minimal or no assistance, with or without an episiotomy, without fetal manipulation, for example, rotation or version, or instrumentation such as forceps, of a spontaneous cephalic vaginal full-term single live-born infant. This code is for use as a single diagnosis code and is not to be used with any other code from Chapter 15. So even just using forceps or instrumentation would preclude us from using this code. It has to be a cephalic position. It has to be a vaginal delivery. It has to be full term. And the definition of full term is greater than 37 weeks. So again, we have to make sure that we have only this 080 as the code for this specific situation. And because it doesn't have any complications associated with it, means that we wouldn't have any other Chapter 15 codes on the record. And with 080, the only Z37 category code that we can assign is a single live birth, because any other outcome of delivery is not going to be 080. It means that the very nature of like triplets or twins has now caused some type of quote unquote complication of the pregnancy that is not coded to the 080. And if you have further questions about this, we can go over it in class, but we're actually going to walk through an example in a couple slides. Here's another guideline selection of the OB principal or first listed diagnosis. And the first we're looking at is when episodes when no delivery occurs. So when no delivery occurs, the principal diagnosis should correspond to the principal complication of the pregnancy, which necessitated the encounter. Should more than one complication exist, all of which are treated or monitored, and any of the complication codes may be sequenced first. Now, when a delivery occurs, there's a couple different scenarios we're going to look at. So, when an obstetric patient is admitted and delivers during that admission, the condition that prompted the admission should be sequenced as the principal diagnosis. If multiple conditions prompted the admission, sequence the one most related to the delivery as the principal diagnosis. A code for any complication of the delivery should be assigned as an additional diagnosis. In cases of a cesarean section, if the patient was admitted with a condition that resulted in the performance of a cesarean procedure, that condition should be selected as the principal diagnosis. And then if the reason for the admission was unrelated to the condition resulting in the C-section, the condition related to the reason for the admission should be selected as the principal diagnosis. Again, we're going to look at some examples of these. So our first example is a patient is admitted in active labor at week 38 of pregnancy. The patient experienced no complications during her pregnancy. She labored for 7.5 hours and delivered a live-born male over an intact perineum. No complications during labor or delivery. So this looks like the perfect scenario where we're going to have an uncomplicated, our 080 code. So the first, we're going to look this up. We're going to go to pregnancy. And again, as a reminder, we have the C also delivery here because we actually did have a delivery. So that's what we're going to do. Since we actually had a delivery, we're going to go to delivery. And then we have this subterm, completely normal case. And if we look at this, this actually fits our definition of what an uncomplicated delivery and pregnancy would look like. So we're going to use that code 080, and then we're going to code our weeks of gestation, and we're going to go to pregnancy, and that's weeks of gestation. So that's going to be our subterm is weeks of gestation. And then ours is 38 weeks. So we're going to get our code Z3A.38. And then we have to code our outcome of delivery. So then we go to outcome of delivery, and I'm just showing you here, this is the complete full index entries of all the different outcomes of delivery. So just be careful as you're going down, but ours is a single live born, and that's Z37.0. And remember, that's the only code that we can use with the 080. So let's see what this looks like in the tabular. So we get to the tabular and we have our code. And again, it's just 3 digits. There's no further specification in this code. So it is a full code with just 3 digits at 080 and counter for full term. Our pregnancy was full term. It was 38 weeks. And remember, the definition of full term, according to ICD 10, is anything greater than 37 weeks. So we have full term uncomplicated delivery. And then we have here just a reminder, the definition of full term is greater than 37 weeks, which that's a nice reminder. You might want to highlight that. And then we have, again, our definition of what this code means, which is, again, delivery requiring minimal or no assistance with or without episiotomy, without fetal manipulation, rotation or version, or instrumentation, which would be forceps of a spontaneous cephalic vaginal full-term single live-born infant. And then we have here, use an additional code to indicate the outcome of delivery, which is what we did. So here we have our weeks of gestation, and we're at category Z3A. And then we have our code here, Z3.38, 38 weeks of gestation. And then we have a code first note, which we know because this can only be a secondary code. We have a reminder here that codes from category Z3A are for use only on the maternal record to indicate the weeks of gestation of the pregnancy, if known. And then we're going to have our outcome of delivery, which we got from the alphabetic index as Z37.0, and that's a single live birth. And that is going to give us our final coding, and we're going to have 080 and counter for full term uncomplicated delivery. We have a 38 weeks gestation of pregnancy and single live birth. So again, we always want to make sure that one of these two categories is going to be coded on a birth record if we have the documentation to support it. Let's look at another example. What ICD-10-CM coding is reported on the maternal record for a delivery of triplets that are all live-born at 32 weeks of pregnancy? So let's go to pregnancy. And the alphabetic index is our main term. And then we have complicated by multiple gestations, okay? So here we have a triplet, and it's giving us a C note to C pregnancy triplet. So we're going to do that. We're going to go to a subterm triplet. And under triplet, we have some options here. So we don't have any of this additional information. So we're going to scroll down here and we are going to use our unspecified number of placenta and unspecified number of amniotic sacs. And that's going to take us to 030.10. We definitely have a check mark here, so we know we're going to have some further digits, but we're just going to make note of that. So then once again, we're going to have our outcome of delivery. And in this case, we have all live born and we had triplets. So our outcome of delivery is going to be outcome, all live of delivery, all live born, and then we're going to get triplets. And then that's a Z37.51. And then finally, we want to code our pregnancy weeks of gestation. And here we are at 32 weeks. So that's Z3A.32. Now let's see what this looks like in the tabular. So in the tabular, we have our triplet pregnancy and its unspecified number of placenta and unspecified number of amniotic sacs in the third trimester. So that's 030.103. Then we have our outcome of delivery code, which is going to be Z37.51 for triplets, all live born. And then we're going to have our weeks of gestation, which is Z3A.32 weeks gestation of pregnancy. So our final answer is going to be 030.103 triplet pregnancy, Z3A.32 for 32 weeks gestation, and Z37.51 for triplets, all live born. So another example is a pregnant woman in her 40th week has gestational diabetes, which is controlled by diet. She was admitted to the hospital for a C-section. She delivered a healthy male infant. What ICD-10-CM coding is reported? So again, we're going to go to pregnancy complicated by, because we have this gestational diabetes here. And then we're going to go complicated by diabetes gestational. And then we have a C note to go to C diabetes gestational. So we're going to go out of this pregnancy main term here, and we're going to go to main term diabetes and then look at gestational. So here we are at diabetes. And then we have gestational and parentheticals in pregnancy, a non-essential modifier. And then we want to, this is a delivery. So she delivers a healthy male infant. So we are going to pick, we're not going to jump right to gestational, just gestational diabetes. We are going to scroll down because we have in childbirth, and that's 024.429. But we also know that our documentation says that it's controlled by diet. So here we're going to have 024.420, and that's going to be our code we're going to look up in the tabular. So here we are at gestational diabetes mellitus. And again, it's our tip as a reminder that we do not report if she was insulin controlled or oral hypoglycemics controlled. Again, because here at our code set and our final character, we have gestational diabetes in diabetes mellitus in childbirth, diet controlled. Here you can see we have insulin controlled. Here you can see controlled by oral hypoglycemic, and then unspecified control as well. Now, we wouldn't be coding these Z codes, which typically indicate these items here, because they're packed into the code already. So we wouldn't need to code them, and it would be double coding. So our final code, again, is going to be 024.420, gestational diabetes mellitus in childbirth, diet controlled. And again, we're not going to look up our single live birth again or a gestation. We have already gone through that twice, and you should be proficient in that by now. But just remember, anytime we have our weeks, and we know that what she delivered, and she delivered a healthy male infant, and that's a single live born, these are going to go on that record. So we have at 39 weeks gestation, a 26-year-old woman is admitted for precipitous labor and vaginally delivers a healthy baby girl. What ICD-10-CM coding is reported on the maternal record? Now, I want you to pause the recording, and with the principles that we've learned so far, go ahead and code the chart and see how you do. So for this one, we are going to start at delivery. And we can see it's complicated because we have a delivery here. And we can see the delivery is complicated by a precipitous labor. And that is going to be 062.3. Okay. And then we're going to look this up in the tabular, and we have 062.3. We don't have any further digits, and we didn't really have any really interesting notes at the category level for 062. So again, that's going to encompass why the patient was admitted for precipitous labor, and that's 062.3. We don't see any other types of complications documented in this chart. So that's going to be it. That's going to be our codes. We're going to have our precipitous labor of 062.3. We're going to have Z3A.39 to capture our 39 weeks gestation of pregnancy. And then we're going to have our single live birth, which is Z37.0. All right, guys. So that's going to be everything. If you have any questions, please reach out and we can definitely go through some of these in class. And I actually saved some of these examples for when we do PCS coding because we're definitely going to want to know how to code for a vaginal delivery versus a C-section delivery versus when it's a vaginal delivery and they use forceps. It's pretty simple PCS coding, but we definitely want to know how to do that. So I saved a couple examples and we will do some more diagnosis coding when we get to our PCS cases as well. All right. Please reach out with any questions. Thank you.